Neighbours for Active Living, also known as Neighbours, is a health social integration program by Southeast CDC and Eastern Health Alliance. By 2030, 1 in 5 Singaporean residents will be aged 65 years and above. This is a threefold increase to 960,000 elderly from 350,000 today. They are 4 times more likely to be hospitalized than younger Singaporeans. In 2013, Eastern Health Alliance, the regional healthcare system for the East, identified many vulnerable seniors with high healthcare and social needs. Meet Madam S. She is 74 years old and affected by multiple medical conditions. She's single, stays alone, and has no family support. With irregular meals, default on medication and follow-up appointments, complications arise and she gets readmitted to hospital.
The Neighbours Programme was set up to ensure that residents continue to receive good care in the community after they have been discharged from hospital. The programme does this in several unique ways. First, we have a community care team that is embedded in the community. This allows the team to form close relationships with the community and truly understand the needs of residents. Second, there's strong partnership with community partners. This ensures that residents have access to a wide range of services and are able to receive long-term support. Third, the program takes care of both the health and social needs of the residents. When the community care team visits the residents, they will address all of these issues.
We have a community care team which is sited in each division. We are made up of 3 full-time staff, community assistant and community coordinator. They are trained either in nursing, social work or in community healthcare setting. We look out for red flags. For them who have difficulty getting a transport, we will help to arrange for transport. There are times that family members are not able to bring them down. A community assistant will also do medical escorting. We also do follow-up appointment reminder. We also have situations where there are emergencies and they do not know what to do, and usually either we bring them to a GP or to a poly for a follow-up. And for those we notice that have some issues like emotionally unstable or feeling a little bit depressed or lonely, there are areas where we come in and we will get them out from their home, participate in the social activities at the Senior Activity Centre, get them involved in some of the RC activities.
The social well-being of the elderly is of concern to us. In Southeast CDC, we work very closely towards ensuring that we have an effective social infrastructure. One resource that's available in the community really are our neighbours. Neighbours, fellow residents who I think can come forward and help and support. This also nurtures the sense of voluntary spirit in the community.
Southeast CDC and Eastern Health Alliance co-created Friend a Senior program to help residents and volunteers acquire useful knowledge and practical skills in befriending. With 3 days of Friend a Senior training, they contribute 2 hours weekly towards one cause: befriending and improving lives of vulnerable seniors.
The volunteers, the befrienders, are being trained to understand, appreciate the different health issues that comes in play. So when they come to the community, they are able to then connect better with the residents at different capacity.
在这次的培训当中，吸收到很多知识，以长者跟病患的沟通，我们也学到这方面的技巧，能够了解他的背景是最好的。去他家访问的时候，多观察，多跟他语言上的交流，我们把这些所得到的知识回来反映给我们的社工知道，那么我们就心安理得了。
I believe in the Chinese saying, it says, 远亲不如近邻. I suppose it means that you can rely on a relative, but if they're far away, the best person to support you is your neighbour who lives nearby. So the Neighbours for Active Living program harness the resources and support from immediate neighbours to help fellow citizens. That, I think, will help us increase the sense of volunteerism, increase the spirit of wanting to help another, and for Singaporeans to believe that they have much to give to fellow Singaporeans.